Chapter 6. Control of Diseases. We know that the ability of enjoyment and physical happiness depends upon our physical wealth. If body is not healthy, man's all-round development will be stopped. A healthy body is the first step for healthy life. If we take proper care of our health, we shall enjoy long life. The development of the nation is dependent on healthy citizens. Will Durant stated, "Illness is a crime. We do some stupid work for our health subject. So the nature takes some hard steps to correct our stupidity. For this, we have to suffer from the pain. It is a tutorial fee making a healthy life. There are 3 causes for contagious diseases, and diseases through insects are as under. Decrease in immunity power. Bacteria of the disease anyhow enters the body and the suitable atmosphere allows the bacteria into the body. We will study the information of characteristics of the disease, medical treatment of the disease, and prevention of some contagious diseases and caused through contact. 1. Ringworm. Symptoms. This is an infectious disease. This disease is caused by bacteria, fungus. It is seen mainly on the parts like neck, waist, inner part of thigh, head, armpit, and parts covered with hair. Due to this disease, there are round sores with boils on the skin, having heavy itching sensation. The round sores spread at due side and recover afterwards. After some days, the color of round sores become purple, the hair falls down. There is drip like water from round sores after itching and heavy pain is there. The itch occurs at night instead of daytime. This disease is seen mostly in monsoon. It is caused by fungus. Treatment or prevention. Take care of personal hygiene. Take bath with clean water and soap to avoid contact of the person of ringworm. Do not use the clothes, ornaments, shoes, socks, helmet, etc. of the patient. 2. Psoriasis. This is a autoimmune disease also caused by fungus like ringworm. Symptoms. Dim white stains get caused on chest, back and mouth. Sometimes there is little itching. Treatment or prevention. Take care of personal hygiene. Take bath regularly with clean water and soap. Use clean towel. Clean the body and dry it. 3. Lice. Bacteria of lice are found in the head and other parts of the body. The female lice puts her numerous nits, that is eggs of lice, in the hair and put on clothes. The nits break and lice comes out. The old eggs of lice are called nit. The nits stick with hair. Symptoms. The head gets itching sensation. There is disturbance in sleep. There is abscess in head and there may be fever. Treatment or prevention. Do not use clothes, bedsheet, comb, brush, cap of the lice affected person. Wash the hair with warm water. The nits are closely stuck to hair, so wash with little spirit. Then use pointed comb. 4. Scabies. This is a skin disease. This disease is caused due to itch mite parasitic germs. The cause of this disease is of insufficient and impure water. Itch mite germs enter in the skin and eat up and go ahead. The female itch mite puts nits in the skin and the disease spreads. Symptoms. Scabies get caused on skin at the places between fingers, waist, wrist, elbow, armpit, the place between thighs. Pus like liquid can drip, that is trickle. It itches very much at night. This disease spreads ahead to other parts of body and there are pus, itches very much and there will be abscesses. Spread. This disease spreads with contacted patient and use of the clothes of the patient. Take care of both the causes. If one person is affected in the family, it will be affected to other person of the family also. Boys play in pre-primary and school together, they may be affected. Treatment or prevention. Before applying the scabies medicine, it is necessary that pus becomes dry. Boil the clothes of the patient because the germs stick with clothes. The part of scab is affected should be washed with rubbing and scrubbing so that broad dip of germs will be opened. Then apply benzyl benzonate on that parts. Take care that it does not touch eyes or mouth as it is very poisonous. Due to this treatment, the disease comes into control. There may be itching for 10 to 15 days. It is due to allergy of the dead germs. The prevention for the diseases of skin as mentioned above and for other diseases. Wash the whole body with rubbing and scrubbing every day. After taking bath, clean the whole body with separate towel or with clean piece of cloth. When body becomes dry, then put on the clothing. After wiping the body, towel should be washed. The care should be taken that there will not be detergent or soap in the towel when it was washed. When children come home after play, the hands and legs should be washed and dry them. Especially wash the hands and legs before night sleep. Try long-term planning for increasing of economic, social and education level of people. Use loose cotton or khadi cloth so that sweat should be absorbed. The skin becomes dry and clean. Do not use the cloth or comb of the deceased person. Take nutritive diet. Do not suppress the disease by taking self-medication. The government should make necessary arrangement to provide sufficient water to the public. There should be facility for the treatment for skin diseases in the primary health center and in the government hospitals. Sexual diseases. Sexual diseases enter from one body to another body through organs of generation when doing sexual intercourse with the person suffering from the sexual disease. There are three main sexual diseases: gonorrhea, syphilis, and AIDS. General symptoms of sexual syphilis diseases. There are scars on the sexual organs. Watery liquid trickles from it. There are create scars on the skin with pain. Joint pain is there. There is headache. The nervous system is damaged. There is more tiredness, loss of weight. Now, we shall get the information of three sexual diseases. 1. Syphilis. This disease is caused by Treponema pallidum bacteria. They are springtime bacteria. These germs enter from one person to another person while doing intercourse with person suffering from the disease. There occurs syphilis on the penis after intercourse within 3 weeks to 3 months. In case of women, this syphilis occurs in vagina. Symptoms. The first symptom is scar on the sexual organs. There is swelling in urethra. The scar is healed without any treatment or incomplete treatment. This is very dangerous hidden disease. The patient feels that he is free from disease, but it lies in hidden position. It spreads out in the whole body within 1 or 2 years. In this disease, there are different types of small boils on the skin, but there is no itching. There are special type of scars on the wet part of body like anus. Such scars also appear in the mouth. In addition, there is pain in the joints of knee, shoulders, etc. Again, this disease remains in sleeping position and it destroys nervous system. The whole nervous system of the brain gets topsy-turvy or maybe polio. There is a possibility of heart disease. In addition, there appear special types of nodes and scars. There is serious effect on the conceived child, and sometimes the child is dead in the fetus or dead as soon after delivery. When this disease appears at the time of birth, it is called produced syphilis. Prevention. We can trace this disease by blood examination test. Avoid unsafe sex for prevention. Treatment of syphilis. The penicillin and other effective medicines are available. The complete treatment is necessary for this disease. 2. Gonorrhea. The intercourse might have been done with the person suffering from gonorrhea in case of males as well as females. During intercourse, the couple golanu, that is gonococci, bacteria enter the body of one person to another through sexual organs. After 2 to 7 days, symptoms are seen. Symptoms. For men, pus comes out from the urethra. He has to pass urine frequently. That is penis, pains with burning sensation, suffering from uneasiness, and sometimes the fever is there. The disease disappears after some time, but it reoccurs frequently if not treated properly. For women, there is slight feeling of burning sensation. The symptoms of gonorrhea are not easily recognized. The liquid flows from uterus, but there would be other causes. Sometimes a woman is not in a position for impregnation. Prevention. It is stressed out by doing laboratory tests of the pus coming out from penis or uterus. Treatment. The medicines are available for this disease. By doing early treatment, it is stopped barrenness. The prevention for syphilis, gonorrhea, and other sexual diseases. The ideal of way is to have only one wife, or faithfulness towards one lover, that is, or beloved, are useful for prevention of the diseases. The diseases can be prevented by using condom at the time of intercourse as an alternative step. In these diseases, both the partners, husband-wife, should take treatment simultaneously. If possible, give the treatment to the persons who are connected with the infected person. Find out such persons for treatment. The prevention for AIDS are mentioned. The prevention for all the disease are same as mentions for kids. 3. AIDS. When there is decrease in immunity power, the trouble starts. The word AIDS, acquired immunodeficiency syndrome, suggests the meaning. Infectious diseases of various kinds attack on the body due to the AIDS. The word indicates group of words. It is known as garish, acquired immunodeficiency syndrome. Spread of AIDS. To come with direct contact of blood of the infected person. Sexual intercourse with the person suffering from AIDS. By taking in blood of the person suffering from AIDS. Through injection, needle and instruments of surgery and surgical operation. Through pregnant mother to fetus. HIV or AIDS does not spread in this way. By shaking hands, by embracing, by normal kissing, by traveling with a person of having HIV or AIDS, using things of infected person, using telephone, pen, soap, socks of infected person. The diseased period of HIV is about 6 months to 20 years after entering the germs of HIV into the body. Symptoms of AIDS. The symptoms in adults and in children are different. Symptoms seen in adult patients. Continuous loss of weight without any reason. Loose motion for more than a month. Fever continuing for more than 1 month. TB comes up. Diseases of fungus may be caused. Scars in mouth, weakness. Symptoms seen in children. Very slow growth rate or loss of weight. Loose motion for more than 1 month. Old fever for more than a month. There is swelling on whole body. There are white scars in mouth and neck. Suffering from infection diseases frequently. Suffering from whooping cough more than a month. Treatment of AIDS. Various antibiotic medicines have been developed for treatment of this disease. With the help of this medicine, period of life survival is lengthened. Yet no medicines have been developed for this cure. Due to this, it is only remedy to stop AIDS. Prevention of AIDS. 1. The ideal of vow to have only one wife or faithful towards one lover. It can be prevented by using condom at the time of intercourse. 2. First test the blood of blood donor, then voluntary donors should come forward and donate blood, so there will be prevention on professional blood donors. 3. Try to recover the disease without injection. If injection is necessary, use new needle. 4. The injection and equipments for operation must be sterilized. 5. Living life should be free from addiction. 6. The burden of urbanization, unemployment, mental strain should be reduced. 7. Instead of seeing lustful scene in TV, film, periodical and advertisement, see the healthy and individual development program. Increase the publicity of innocent entertainment and moral values. 8. Prevention for this disease is presently the problems which are due to insufficient nutrition. 9. To stop the social stigma calculator to AIDS, give sympathy to AIDS patients. By doing this, people will not conceal the disease. Disease spread through germs. Malaria. Malaria causes from malarial parasite germs Plasmodium virus. The female Anopheles mosquitoes are mainly responsible for spreading malaria. When female Anopheles bites the malaria patient, it sucks malaria germs with blood. These germs develop to a limited level. When these mosquitoes bite to a healthy person, malaria germs enter that body. In this way, malaria is spread from one person to another. Symptoms of malaria are seen after 10 to 15 days after mosquitoes bite. 1. There is cold and feeling of shivery. There is fever. The shivery is continuous for more than 15 minutes. 2. The fever is there for some time. There is feeling of vomiting and nausea. The patient suffers from uneasiness. There is pain in body. 3. The fever goes down and heavy perspiration is there. 4. The fever comes daily, alternate day or third day. 5. Sometimes the fever affects the brain. Patient becomes unconscious and prattling. 6. The germs of malaria attack the red cells and destroy them. The body of the patient becomes palenamic. There is enlargement of spleen and weakness. The patient suffers from jaundice. Treatment and prevention. 1. If patient has heavy fever, ice should be rubbed on the head. The temperature should be lowered by putting piece of cloth soaked in ice or salty water or cologne on forehead, stomach, chest and hands and legs. 2. The patient should be provided with light food, that is citrus juice, tea, milk, kanji, etc. 3. The patient should be kept in a good ventilated room and give him sufficient rest. 4. Use mosquito net. 5. As per doctor's instruction, give him chloroquine, that is quinine tablets. If there is recovery from fever, give the medicine up to 1 week as per instruction of the doctor. The strong effort should be made to control the production of malaria-spreading mosquitoes. Generally, malaria-spreading female mosquitoes Anopheles breed in clean water. Such peat and puddles should be filled or water should be taken out. The burn oil, kerosene, DDT should be sprinkled once in a week in this water to destroy the worm of mosquito. The water tank, container and septic tank should be covered with airtight cover. An iron net or cloth net should be covered to the pipe which is used for air and exit of water so that mosquitoes will not enter. Put guppy fish in peat puddle and pond. This type of fish eats the worms of mosquito. In the night while sleeping, cover the whole body with clothes. Use of mosquito net. Immediate diagnosis and treatment decreases the malaria as well as stopping malaria spreading. Filariasis. Thin and thread like germs make the human leg like that of an elephant. This disease spreads by mosquito. So many people are suffering from this disease in India. The proportion of this disease is higher in Uttar Pradesh, Bihar, Andhra Pradesh, Odisha, Tamil Nadu, Kerala, South India, southern part of Gujarat. In fact, patients of diseases other than those with filariasis are included in this category. A Culex female mosquito brings up in a dirty water. This mosquito bites the patient of filariasis. It sucks worms of filariasis with blood. When it bites the healthy person, the worm of filariasis enter the body of healthy person. After time, these microfilaria become adult. Each female filaria produces 50,000 microfilaria, that is larvae, per day. There is obstruction in lymphatic. Due to this, as per lymphatic places, there is swelling on hands, legs and testicles. The affected organs are expanded. If the care of prevention is taken early, the swelling will be reduced and there is relief. When microfilaria enter into body, Symptoms are noticed within 3 months. In these symptoms, many a times there is fever, there is pain in the one or other part of body. Near that part, there is swelling on lymphatic of that part. The skin is seen reddish. There is pain when it is pressed. There rise red round sores. Moreover, there becomes swelling on testicles. Sometimes the flow of urine is greasy and thick like milk. Diagnosis. For the exact diagnosis, blood investigation is necessary. When the patient is fast asleep at night, between 10 to early in the morning at 2 o'clock, 4 to 5 drops of blood are taken on slide and investigation will be done. Treatment. In case of early diagnosis, this disease is controlled by tablets. When the disease getting severe, operation can be tried. Its long-term results are not good. Prevention. This disease is caused by mosquito. Take care that there are no mosquitoes around. The immediate treatment is necessary. Worms. One or other types of parasitic worms are there in the big intestine of the most of people. In different languages, they are known as karam, krumi, charam, hersia, alcian, savalia, worm, insect, stomach worm, etc. There are main 4 types of worms. 1. Roundworms. These types of worms are seen more in children. They eat the food from intestine so that children suffer from inadequate nutrition. It is possible in our country, out of 10, 5 persons have these types of worms in their small intestine. The length of each worm is 20 to 25 centimeter. Eggs of roundworms, which are in excreta, are entered into intestine by polluted water, food and earth through mouth. Here they puncture the wall of intestine, go into liver and mix with blood. They transfer into insect in arteries and enter into windpipe. They reach up to throat by cough, enter into stomach through food canal and reach intestine. Worms become adult within 2 months and eating food also. The longevity of worms is 6 to 12 months. They are light rosy and like earthworms. Symptoms. Pain in stomach, vomiting, nausea, eating food there is no increase of weight, inadequate nutrition, dry coughing, swelling of stomach. Sometimes intestine becomes closed due to increase of worms and constipation starts. Their operation is needed. Sometimes worms come out by excreta, mouth and nose. There is itching sensation. Eggs of roundworm are recognized under laboratory investigation. 2. Threadworms. These worms are white in color, 1 centimeter long and like piece of thin thread. Its longevity is 1 to 3 months. These worms live in big intestine and from they go ahead to anus, and near the mouth of anus they put eggs in skin. So there is itching sensation. Due to itching, worm eggs accumulate in nails. While taking food, they go to stomach along with food or water. Then they reach to intestine. In this way, their span of life is continued. There is pain at the time of going to easy nature. There is burning sensation at the time of passing urine. One has go to frequently for passing urine. We can see the direct movements of the worms in excreta. 3. Hookworms. More than 30% persons have this type of worms in their intestine. The ratio is more of these worms to persons of 15 to 25 years of age. These worms harass to an inadequate nutritive people or other persons infected with disease. These worms stay for a little time in healthy person, so there is no sign in such person. These worms drink the blood to stick on the thin veins of intestine skin. In this way, hookworms drink blood from human and so anemia is caused. These worms are seen more in the persons who move barefooted, workers on tea garden, workers of plantain, workers of tobacco farm, earthen workers, etc. Symptoms. Due to anemia, tongue, lips, nail and cover of eyes become pale. These are troubles like inadequate nutrition, weakness, fatigue, fast breathing. So physical and mental developments are hampered. The more serious condition is that heart is expanded and it may stop. If hookworms, maggots are in lungs, coughing may be caused. Prevention. Generally other worms are seen with naked eyes, but these worms are not seen. So excreta should be tested in laboratory. We can find the eggs and diagnose. 4. Tapeworms. Tapeworms are white in color, flat, about 2 meters long and 6 millimeters broad, reside in intestine. Actually they reside in animal meat. When the meat of pig, cow or another animal are eaten raw or half cooked, the maggots of the worms enter into intestine. Generally these maggots of worms are not injurious. These maggots become adult and transform into worms and put eggs. These eggs come out by excreta. They enter into the mouth of another person by uncleanliness or other person or by any way. These eggs reach into intestine and come out as fresh maggots. They puncture the intestine wall and reach the parts of liver, brain, eyes, etc. with blood. When they reach here, within 2 to 3 months, they damage permanently. Symptoms and prevention. Digestion slow down. Slight pain in stomach. The simple infection of tapeworms is easy to know. They are seen in excreta of a person in 1 centimeter pieces separately or jointly, more in length. Prevention of all type of worms. Worms have not spread anything. To drink the blood of the people and eating valuable food in this high prices period. Especially, laborers become pelnes. They are forced to leave labor and become unemployed. For the prevention of this disease, 1. To cut nails regularly and keep clean. To wash hands with soap. To wash hands with soap after going to latrine. Before taking food and before cooking, use bowl with a long handle for taking water. Do not take water from earthen vessel with hands or with pot. Use only bowl with a long handle. It is best if the earthen vessel is with tap. 2. People should use hygienic latrine. An arrangement should be made for removal of excreta. The government gives the aid for preparing latrine. Use that aid for preparing latrine. 3. First wash properly vegetables and fruits and then eat. 4. Give immediate treatment to the patient of worms disease. The person who has more possibility of worms disease, medical test should be done every 6 months and give him necessary drug tablets. 5. Separate shoes should be used. After working on earth or farm, hands should be rubbed and washed the hands and washed. Do not sleep land or farm, especially on wet earth. 6. Keep water facility in traveling. If possible, do not eat market food. Use only clean pure water and food. 7. The immunity power should be maintained by taking green leaf vegetables, fruits in diet.